Hello and welcome, CitySpidey viewers, to this time's episode of CityFit. We have a very special guest today, Dr. Kalpana Nagpal. Dr. Kalpana Nagpal is Delhi's leading ENT surgeon, and she has many accolades to her credit. It's a pleasure to have her on the show. And today we are going to discuss the careers in ENT, in the field of ENT that is ever growing, and people are ever curious about what this field is all about. So today, Dr. Kalpana Nagpal joins from Apollo Hospital, where she works. Welcome, Dr. Nagpal.
Thank you, Ketan. It's a good subject that you have chosen. A lot of people would like to know what is all ENT about and how good is it a career option. So,
Yes.
to introduce myself, yes, I'm a senior consultant in the field of ENT and head and neck surgery at Indraprastha Apollo Hospital, New Delhi.
So my first opening question to you is, and for the layman, people often wonder that they see gynecology as an independent field, they see cardiology as an independent field. However, the layman wonders that why ear, nose, and throat, the specialist for all these three different parts of our body, is usually studied as one science. What is the intricate physiological relation between ear, nose, and throat? So maybe that is one question for our curious readers. We can take that question first.
Yeah, so ear, nose, throat basically have the body's sense organs. So these are very, very important organs in the human body. To perceive taste, to perceive smell, to hear. And that's how a person is happy. If you have good taste and good smell, and if you can hear well, what more do you want to ask for? Now, ENT, it's basically also known as otorhinolaryngology. So, oto is ear, rhino is nose, laryngology is basically larynx, that is voice box. But together, this subject is also known as otorhinolaryngology. And nowadays, otorhinolaryngology has an extended name. Now it is also called otorhinolaryngology and head and neck surgery. So, ENT and head and neck surgery is one branch.
Well, I think you can focus more on ENT. What are the common disorders or common complaints that patients reach out to? And as you have told, it's also related to the neck and the head. So we can move to that part a little later. First of all, we can just break this into pieces, like how ENT affects our day-to-day well-being and health, and what kind of common complaints do patients come to you related to ENT?
Right. So first we'll deal with common complaints. Like let us take ear first. Now ear, hearing loss, that is the most common complaint with which patients come to. The hearing loss could be sudden, or hearing loss could have been there for a long time. Can be due to some systemic ailments like diabetes, or it could be suddenly going away because of some viral illness. Even post-COVID, a lot of patients have been coming to me with hearing impairment. So hearing impairment, there are lots of reasons. There are many causes which are pertaining to the middle ear or the inner ear. And sometimes they're part of some syndrome, meaning this symptom may be associated with some other abnormalities in the body. So hearing loss is a very, very vital thing, and it's a common complaint with which patients come to me. So now, apart from this, you can have tumors in the ear. So there can be some swelling in the ear which is growing, or there can be severe pain in the ear. It can be due to infections, or it could be due to tumors, it could be due to some other infections, can be bacterial, it can be fungal. Infections can be externally related, middle ear related. Sometimes, there could be some abnormalities in the bones in the middle ear. There's a condition called otosclerosis where one of the bones is not moving, it's just fixed. Also nose and throat common complaints, let me tell you. Nose, people can complain of nasal blockage, loss of smell, sneezing, watering of the nose, or itching in the nose. And, it can be either partial loss of smell or total loss of smell. So, and then it can be presented with associating symptoms like, nose symptoms along with bronchitis or asthma, or nose symptoms along with the swelling in the eye. So there are several conditions again in the nose. It can be allergic inflammation, or it can be, a deviated nasal septum. Patients can be, presenting with nasal polyps, which is like, something like green grapes. There are multiple growths inside the nose, so these are polypi. Or they can be tumors in the nose, or they can be brain fluid leaking through the nose. I mean, there are several conditions like this.
That is very useful information, especially for our listeners, because you don't know when the symptoms can exhibit. And as you pointed out, that any delay in presenting before the doctor can make those symptoms more and more serious. My next question was the relation between the neck and the head to this stream of study, after which we can expand further on the careers in the stream of ENT. So my question is that how is neck and brain intricately related to the study of ENT?
Yes. Now, ENT and head and neck surgery, why is this being combined? It is because we treat with throat, we deal with a lot of throat ailments where there can be conditions inside the throat associated with some swelling in the neck. For example, there can be cancer in the tongue, or a cancer in the cheek or in the floor of the mouth associated with lymph nodes in the neck. Then which means the cancer has spread and it's called metastasis. Or there can be ailments associated with salivary glands, like the swelling in the submandibular salivary gland or swelling in the parotid gland. Now, these are all salivary glands. Those also we are dealing with. Now, brain.
Yes.
Good question. Like, there are pituitary tumors which we remove from the nose rather than giving a big cut in the skull and doing brain surgery. Nowadays, we have sophisticated endoscopic nasal surgeries where we are removing the pituitary tumors through the nose. And similarly, brain fluid can be leaking through the nose. And we, instead of again doing a big surgery, we could do an endoscopic repair of the CSF leak. And that can be done through the nose, so we are avoiding cuts, etc. So basically, we're doing a lot of, treating a lot of conditions in this area. And that is why the specialty is called ENT and head and neck surgery, or otolaryngology and head and neck surgery.
So over to our next question, which was actually the crux of today's discussion, is the kind of careers that are there in ENT specialization, and what can MBBS students look forward to in terms of the specific careers in this branch of study?
Excellent question. Actually, when I did my ENT, that was 20 years ago, females, women otolaryngologists were very, very few. So taking ENT as an option, more men were seen taking this branch, and women were very few. And that's how, even in Apollo, in my department, I've been the only woman for a very, very long time. Whereas now I see lots of juniors, especially the current trend in the last 5 years, I've seen more and more females opting for this branch. And I would actually suggest this as a very good career option, because ENT, you're not too stressed because you don't have, the work is usually done within the normal routine duty hours, and in the night, unlike gynecologists, you don't have to be waiting for many hours inside the operation theatre, waiting for a labor to happen. ENTs are much more, comparatively easier option. But at the same time, the subject is so vast and so many advances have happened, especially since the technology has come into medicine. The technology has changed it way too much. For example, we're doing so many interesting things like laser surgeries in ENT, we're doing co-ablation surgeries in ENT, we're doing robotic surgeries in ENT, and so many different ailments that we're handling. And it is a very good career option because of all these advancements, even making money. I mean, people are like, finally, ultimately, a lot of people want to become doctors because, they think they'll have a better lifestyle. They can drive Mercedes and, Audis, etc. So it's not, if people are looking at that kind of thing, again, ENT is a good branch of, to earn money.
So while we are talking about, the the intent of this episode is, of course, to reach out to commoners who don't know much about this field, and also about it's also about aspirational students who want to take this up as a field of surgery. India has long become a destination for many surgeries. It has become a destination for health tourism, so to say, for lack of better word. So, how do you see the prospect of ENT growing when we have experts like you and so many other colleagues of yours? How is India developing as a health tourism destination when it comes to ENT surgeries?
So I'm lucky to be working in a tertiary care hospital, like in the Bristol Apollo Hospital is a large corporate hospital. So we do have everything available, whatever you ask for under the sun, or the entire technology equipment. In fact, we're getting a new robot by the end of this month, and it's an advanced model called XI. And yes, in India, there's the ENT and head and neck surgery happening in such a big way that we already have a big, option for medical tourism. Like already a lot of foreigners are coming to us for treatment. Like patients are coming from all over the world, like, especially Africa, Middle East, Afghanistan. Now, because of the war, Afghanis are less, but otherwise we used to get a large bulk of Afghani patients from Bangladesh, from Sri Lanka, from Nepal. So we're getting patients even from Cambodia, Philippines. So all these people, why are they coming? Because we're doing surgeries like cochlear implants, we're doing surgeries like robotic surgeries. Whereas nowadays, because of the endoscopic surgeries and robotic surgeries, the teaching has become, far more easy. And that's why the learning has become far more good. So that's why the surgical training has become far more advanced. Now that is where we can produce better ENT surgeons.
Definitely, that was a very informative answer, and that brings us to the close of this time's episode of CityFit. Thanks a lot for joining us, and thanks a lot for sharing all this information.
Thank you, Ketan. Excellent initiative. Thank you.
Thank you.